And now it's your turn to get free advice from the dentist. Dr. Mark Hyman is here to answer your questions about family and cosmetic dentistry. The number 1-800-807-8255. Good morning.
Good morning, Cindy.
Good to see you.
Nice
You
to be
always
back.
bring some cool toys. What is this?
This is the Sol laser from the Denmat Corporation. What this does, it's a little mini diode laser that you can do biopsies. If the gums are bleeding when you're doing a restorative procedure, you can take the excess gum away.
And you just wear these to protect?
To protect from the wavelength so the eyes aren't damaged.
Cool.
When you need to do frenectomies, when people have extra muscle attachments. It's just a wonderful aphthous ulcers, all sorts of biopsies. It's just really cool.
Neat.
Wonderful and simple and easy to use.
Neat. All right, let's go to the phone lines. We have folks waiting for your answers. Rosa is in Greensboro. Good morning, Rosa. What's your question?
Good morning.
Hi, Rosa.
What's your question?
My question is, is there a set fee for different things like dentures or cosmetic surgery?
Is there a vaccine?
Or a flat, is it a vaccine or a flat fee? I think she said
A flat fee.
A fee, yes.
Yeah, a fee. Yeah, a flat
What are
fee.
the prices?
As far as prices go.
Sure. You know, I think you could speak to your dentist about what problems that you're having, what changes are going on in your mouth. There's a variation in different procedures by how difficult it is. If there's a lab involved, the materials that you're using, and the care and skill and expertise it takes to do the procedure. So that's a neat thing. You can just talk to your dentist. There's always choices from simple to complicated, and that each procedure is different based on those
That's
things.
what I say. It depends on what you are wanting to have happen.
How
what
healthy
you
and how
need.
fast you want to get there.
Yeah.
How simple to how complicated it is.
Yeah, and for things like, braces or whitening and things like that, they're going to be totally different.
Right.
Opposite ends of the spectrum.
They are.
Because we have Tasha on the line from Greensboro. Good morning, Tasha.
Yes, I was wondering if it's best to get, if you need your teeth cut out, or is it best just to get it filled?
I guess she's talking about she might have get a teeth cut out, getting pulled or filled, depending on the.
Gotcha.
If she has a cavity.
Tasha, to me, I think it's always best to try to keep your natural teeth. We're finding folks, if you make it to 65, you have a 50-50 shot of living to 100. So if something can be simply fixed, it may seem like a lot of money short term, but to me, if you spend a couple $100s of keeping a tooth that you can keep the rest of your life, it ends up really being cheap money. For someone that invests in a crown to keep a tooth, it sounds like a lot of money. It's really a cup of Starbucks a day for a year. So if you put it in that context, short term it may be an investment, but I think it's worth doing, absolutely.
Yeah, save what you have. Want to try to pull them for sure. Let's go to Sharon in Asheboro. Good morning, Sharon.
Good morning.
Hi, Sharon.
What's your question?
Yes, I've got a question. My son's gums, he keeps putting oil gel on them.
Right.
But it's not his teeth, it's his gums. His bottom gum.
Is it inflamed and hurting? Is that what the issue is?
Yeah, it's a hurting.
Right. Sharon, I'm sorry your son's having that pain. Oragel is kind of a topical anesthetic jelly to numb the area. So I'd like to know why, depending on the age of your son. Does he have permanent teeth erupting and that's causing the discomfort? If he's got an abscess brewing, the Oragel, the anesthetic jelly, is not going to make a long-term difference. So you'd want to go see your dentist and see what's appropriate. Is it gum disease? Is it an abscess infection? Or is it just the natural process of the permanent teeth trying to push the baby teeth out of the way? So if that is the case, there's different things that your dentist can do to help expedite that, to get the teeth out faster, and also some other things you can do to help keep things comfortable while the eruption process is happening.
Okay, let's go to Lexington where Judy's standing by. Good morning, Judy.
Yes, I had a root canal several years ago, and it's black that my tooth is. What could I do about that?
Right, after the root canal, after adult tooth's had a root canal, it often will turn black because there's no nerve and blood vessel. The tooth has died. So there's different ways to whiten that. One is to internally whiten, internally bleach the tooth, where your dentist can make a little opening in the back of the tooth and put in some carbamide peroxide gel. That's a neat process. Often then that front tooth that's been whitened won't match the other teeth. So it's very simple to have your dentist and their team whiten all of your teeth with the custom-made whitening trays. That can take about a week to happen. You can also have the Zoom, the power tooth whitening, where you can get 6 to 8 shade changes in about an hour. So that's a great way to get your teeth whitened. After that, if you still aren't happy with the color, they could talk to you about doing some bonding or even some conservative veneering of the teeth, and then they would look gorgeous.
All right, thank you.
It's nice to be back.
See you.
Thank you.